kami tanya soalan ke nak kami tanya soalan?
Kena tanya ni. Dia bergantung konten.
Nanti saya pastikan dekat Prof. Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome back to everyone. Now we start for our session third. Before we start, I would like to introduce Prof. Dr. Normala Ibrahim, which is that she is the Dean Faculty of Medical and Healthy Science and also consultant psychiatrist at Hospital Sultan Abdul Aziz Shah at UPM. So now to start our final session, please welcome Prof. Dr. Normala.
Yeah. Okay, thank you, Miss Chairperson. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Thank you, first of all, thank you to Japan Dakwah Center for inviting all of us today to introduce you to the technology, yeah, and also health-related matters. So I am Normala Ibrahim. By qualification, I'm a consultant psychiatrist from the Faculty of Medicine and Sciences and Hospital Sultan Abdul Aziz Shah UPM, as what has been introduced by the Miss Chairperson just now. So generally, I was asked to share about this topic, yeah, introduction to mental health, why mental health matters. Just for your information, we have, in fact, my team, me and my team have been doing this before. There was one time that I think a few years back we went to South Korea. We went to Seoul to introduce about mental health and also to do some intervention with the students, Malaysian students in Seoul. And then before that, we were also in Indonesia, giving talks about mental health. And because of that, I think because majority of the population, if you look at Malaysian population in overseas, majority of them most likely to be students. So JPA, the entity who has given scholarship to Malaysian students has approached us to help them in terms of talking about delivering health education about mental health, because apparently there's a lot of mental health issues among young generations. I think this is a global issues, not just pertaining to Malaysia. We have from statistics, it shows that the mental health issues among young population has rising. So it's rising. So meaning that if you look at the Japanese population, we notice that the suicide rates now is more commonly seen among a young population. All right. So this is just a sharing session, not a lecture. Okay. So I just want to introduce. So this will be the outline of my sharing session. The first one is definition of mental health, and then we just want to look at have some overview of mental health in Malaysia and also mental health in Japan, and understanding stress and its impact, and what are the common mental health disorders that we can see, particularly among all generations. Okay, this is one. This is a phrase coming from World Health Organization (WHO), saying that there is no health without mental health. We can have a good physical health, but if we do not have, we have poor mental health. So, you know, in summary or overall, we do not have that health, that is very very important for us. So there's no health without mental health. So what is mental health? So when we talk about mental health, it's always about, we always refer to those having mental health issues. So when the moment that we say mental health, so we always relate it to those who have mental health issues, for example depression, anxiety, and so on. But if you look at the definition, the concept of mental health by WHO, it is more than just absence of mental disorders or illnesses. We talk about a state of well-being. A state of well-being in which an individual realizes his or her own abilities, right? And they are able to cope with normal stress of life and can work productively, and at the end of the day can make contribution to his or her community. So this is the overall concept of mental health. It is not just having mental health illness or mental health disorders. It is about your ability to cope with the stress in your normal life, and you'll be able to produce productively, to work productively, and at the end of the day you can make contribution to society. Okay. All right, just to give you some overview about mental health in Malaysia. So under the Ministry of Health Malaysia, we have a National Health Morbidity Survey, and this happens every 4 years. And then we're not just looking at the physical health, like diabetes, or hypertension, or any physical health that is common among Malaysian population. They also do some surveys on mental health issues in Malaysia. So it happens every 4 years. So I think the last one was in 2023. And then Malaysia also has this mental health policy, a set of organized value principles where we refer to this policy in order to program our activities in Malaysia. And then we also have National Strategic Planning for Mental Health 2020 and 2025. So it's gonna end. I think there'll be more revision on this strategic planning so that it will be extended. So mental health related burden makes up approximately 37% of total disability in the country. So meaning that if you look at the burden of the disease, burden of mental health issues in Malaysia, it makes up to 37%, meaning that your productivity will be affected, your health economic will be affected because of the cost for the treatment of mental health. So that would actually make up that burden for this mental health issues in the total disability of the country in relation to mental health. And the most common forms of mental disorders among working age population are actually anxiety and depression. So I think later on we will elaborate a bit what are the symptoms of anxiety and depression. Okay. So this is the mental health statistic, based on the National Health and Morbidity Survey from 1996 to 2015. Like I said, every 4 years that they have. The latest one was 2023. So if you look at the prevalence of the psychiatric morbidity, so any issues with regards to mental health, so there's actually increase. If you notice, 16 and above, 16 and above, it shows a sort of a steady increase of the prevalence. So up to 2015, about 30% of those aged 16 and above have mental health issues. So this is in 2019. Okay, 2019, depression among Malaysian adults, 2.3% of the population. So meaning that 500,000 of our Malaysian people, they have symptoms of depression. And if you look at by states, the highest is actually Putrajaya. So Putrajaya, a lot of working population. Okay, all right. Okay. All right. So if you look at the demographic, so the rural area has higher prevalence, And then those who are single has higher prevalence, female has higher prevalence. Yeah. Right. So these are children. So we're talking about children. Yeah. This is 2019. So almost 450,000 students, children were found to have mental health problems. Yeah. So they actually look at what are the mental health problems related to children. So about almost 43% related to peer problems when you talk about children having mental health issues. Yeah? So you just imagine, yeah, if this is the students, the children who have mental health issues at the very beginning, yeah. So you just imagine when they grow up, yeah, into adolescence, which is more challenging, yeah, and then grow up into adults with the current generation and all that, yeah, and the current exposure to the social media and all that. So, we'll see because we will talk about having those people later on to be our leaders, having some mental health issues. All right, so this is 2023. So this is the latest one. So just now is 2.5 to 2.9, 2.9% having depression. So in 2023 is actually double. So meaning that our population is getting more and more having having depression. And then about half of them have thoughts of hurting themselves or being better off that. So meaning that they have these suicidal ideas, suicidal thought. So about half of them, meaning that 500 people, 500,000 out of 1 million, having this thought of hurting themselves and being better off that. Okay, and then so this is just looking at the age group. You see 16 to 17 and 20 to 29 have the highest numbers. So about 7.6 to 7.9. Yeah. So yeah, teenagers and also young adults. Yeah. So all right. So this is 2023. So a child in children. Yeah. So one in six children in Malaysia experience mental health problems. I think this is we cannot deny this, because the trend now, in our clinical setting, we see more and more young people. In fact, in my own clinic, I think I can just open up a clinic special for university students. And then of course we have child and adolescent psychiatrists who look after the children, and their numbers has actually increased. So again, I think they categorized it into what kind of problems that these children have. So again, 46, almost 50% have peer problems, issues, meaning that they are being bullied and all that. Okay, all right. So if you look at these figures, it's kind of worrying. The trend is worrying. So that's why I think the government put down the national strategic planning for mental health. So, and in fact, if you look at these figures, the figure actually increasing after the pandemic also. The pandemic plays a very big role in terms of mental health related issues among our population. I think among all populations in the world. Okay. All right. So Malaysian mental health policy is actually a set of values, principles, and objectives to enhance mental health and reduce burdens of the mental disorders among a population. Okay. And then the significance of mental health to be as important as physical health. So all this while we talk about diabetes, we talk about obesity, we talk about hypertension and all that. Sometimes we forget about mental health. Because it's interrelated. When you have physical health, it will definitely increase your risk to get mental health issues as well. So it helps address issues of stigmatization. Stigmatization is very, very important, because stigmatization will actually hinder someone from getting help. because of the discrimination and all that. And then the main pillar for the development, so the mental policy actually assists in the development of mental programs, and it also play an essential role in delivering mental health services in integrated manner. Okay, so these are the national strategic planning for mental health in Malaysia 2020-2025. So if you look at number 6, promoting mental health and well-being in all settings and target groups. So I think with looking at the figures that we have from National Health Mobility Surveys, so maybe because 7.6 to 7.9 of the population, of the younger population now has more mental health issues mental health issues as compared to the older group. So maybe we should start targeting, based on this strategy. We should prevent these mental health issues from early age of their lives. All right, so okay, so the aim for this national strategic plan in Malaysia is to reduce adolescents' depression rates from 18 to 10% by 2025. So by this year, actually, the figure should reduce. But looking at 2023, it actually doubles. So, and we look at that 7.6 to 7.9 of them having depression. So hopefully, in by this year, end of this year, so this figure would actually just maintain. And National Center of Excellence of Mental Health. So I think from those from the computer science faculty, I think maybe you can actually try to cooperate with this National Center of Excellence on Mental Health in Malaysia, because this is the first initiative, I think the first Center of Excellence on Mental Health in Cyberjaya, and they are actually one of the biggest player in developing programs or coordinating programs for mental health in Malaysia. So they they cooperate with WHO, UNICEF, under a few joint programs, especially looking at children and adolescents. Okay, so just an overview on mental health in Japan. So what are the key issues with regards to mental health in Japan? So there's no, if you read in all either scientific journals or scientific publications, or even magazines on mental health issues. So there's no doubt that Japan has the highest suicide rate. It's about 16 to 17 suicides per 100,000 population. So they have the highest suicide rate. So, and then there are key issues also related to work-related stress. So this is the term they said karoshi, so, or death by overwork, which is a well-known phenomenon in Japanese society. So again, the working population is also one of the target groups that we can actually see. When you look at the highest suicide rates, their young people have a higher suicide rates among the age group. So if you want to do some target intervention, would be the young people, and then also the working population as well. And they are having very high stigmatization towards mental health in Japan. I think this is because highly influenced by their culture. In Japan, they promote the culture of harmony. Okay, harmony meaning that everyone must be in harmony. Okay. So if you have struggles, so it would not be easily being exposed, meaning that it's very difficult for you to disclose struggles. So usually you are expected to manage it on your own, right? So because later, because it doesn't fit into the culture of always in harmony. Yeah. So I think that is one of the reasons. Yeah. Why, like I think Tuan Zul has mentioned earlier, yeah, it's very difficult to get information about mental health in Japan. Yeah. And it's also, people do not talk about mental health. Yeah. Right. Because some sort like a taboo, So I think this is also uh, uh, going back to stigmatization and discrimination, right? And when there's a lot of stigmatization, right, people don't talk about it. Yeah, people will suffer in silence, and also people would not get access to mental health treatment. Yeah, so I think that is when when they keep to themselves, and once it's too overwhelmed, yeah, sometimes it leads to suicide. Yeah, access to care. So this is another thing. Yeah, although I think treatment is available, but because of the culture, yeah, so individuals are expected to manage their own struggles. So that is one of the reason there's very low help seeking behavior among Japanese culture. Yeah, and of course impact of the pandemic. Yeah, so there's increased suicide rates as well. Yeah? Okay, however, with the key issues, mental health in Japan, there are some positive developments, meaning that there's a lot of programs or initiative to increase awareness. So we see that there is increased awareness, and there's a lot of government initiatives. So when they put some guidelines on, for example, suicide prevention, and then increased treatment rates. So meaning that people are getting to get access to mental health treatments. Yeah. So because of the culture also. Okay. Some I think in one of the publications it mentioned that for example, there's one illnesses. Yeah, one illness in mental health related to mental health is schizophrenia. Schizophrenia is when you have experience, patient will experience hallucination, delusion, auditory hallucination, hearing people talking to them, so, and they are, most of them are in the state of unsound mind. Sometimes you will see their behavior is very inappropriate, and looks like what people call they are mad. All right, schizophrenia. Okay. So I think in Japan there was it was mentioned in one of the scientific publication that in order to to encourage individuals with schizophrenia to get treatment, there was a move that they actually changed the term, changed the name of the illnesses so that it will be less stigmatized. So because of that, they noticed that when they change the term, so there's increase of people, coming for treatment. So it is a good initiative, but again, like I said, it is very heavily influenced by the cultures. So like in Malaysia, I think we are a bit more open, and that's why I think in terms of our initiative, we will see more people coming to get treatment, and there's always initiative to increase public awareness and reduce public stigma in mental health issues. Okay, what is stigma? Stigma is negative feelings that people have about particular circumstances or characteristics that somebody may have. So this is from Oxford Dictionary. However, in relation to mental health, stigma, we refer stigma as when there's an individual with mental illness is seen in a negative way. So we always have this perception that people with mental illness is aggressive, is violent. Okay, so they are the one who will kill kill others. So, and then when you talk about stigma, you cannot run away from the term discrimination. So discrimination is when an individual with mental illness is treated in a negative way. So for example, you know that this patient has depression, so maybe, you know, they would, as compared to those who doesn't have depression, so if let's say this person, you know, is applying for a job, so of course you would want you wouldn't want to, you know, sort of, you have some ideas, perception about these people having depression, you know, applying for this job. So of course you want to take someone who doesn't have depression. Okay, so you know, discrimination comes in that way. Okay. All right. There's common misconceptions about mental illness. So this actually leads to the stigmatization. So one, like I said, they are perceived as being dangerous. Yeah, and they should be, and we have this idea that they should be feared and kept out of community. Yeah, so meaning that they should be kept in mental health institution. So as you know that Malaysia has four big mental health institution, two in the East Malaysia and two one in Tanjung Rambutan. Okay, the famous Tanjung Rambutan. It actually is my hometown. So that's why, you know, that's why I become psychiatrist. Okay, and one in Johor, kan, they say is Permai Tampoy. Okay, so if you look at so one in Sarawak and one in Sabah. So if you look at the name also we have changed. In Tanjung Rambutan is Hospital Bahagia, in Johor is Hospital Permai, in Sabah is Mesra, and in Sarawak is Sentosa. Yeah, so just to reduce, you know, stigmatization. All right, okay. All right. The other common misconceptions is they are responsible for their own illness. So meaning that they are perceived as weak or incompetent. You know, for example, if you know, like a patient with anxiety disorder, okay, we have this perception that they do not have this strong spirit, atau or in Malay we say lemah semangat. Okay, but actually whatever that they experience, you know, the anxiety symptoms, yeah, the depression is actually real. Yeah, it's actually valid. Yeah? Okay, so they are perceived as weak and incompetent. Why? Because physically they look okay, they look normal. All right, so it is totally different when you have fracture, for example. Kan, fracture, when you have, let's say, a fracture of the arm, so you wear a cast. All right, so wear a cast, so that actually signifies that you are ill. All right, but people with mental illness, you can, you know, they can, they look they look normal. Okay, they look normal. It's just that, you know, their thinking, their emotion, that is, you know, is affected. Okay, all right. So what will be the impact of stigma and discrimination? All right. So one is they have this fear of being discriminated. So that's why they do not want to disclose. Okay, they do not want to disclose their illness. All right. So I'm sure, yeah, with I mean, the moment you hear that, oh, that individual has, you know, depression, there's always, you know, like some kind of thought. Yeah, okay, some kind of thought. Okay, to tell you the truth, yeah, not the patient, it's not just the patient being discriminated. You know, those who are involved in the healthcare of people with mental health, you know, the psychiatrists, the doctors, in, you know, we are also being discriminated. All right. In a way, okay. We also, I've been in this, in this field for more than 20, I think, 25 years lah, since my MO days. Yeah? So, you know, the moment said, where do you work? Hospital Bahagia. Oh, okay. Okay, you know, like that. Okay. So because of that, okay, they also doesn't seek help. Okay, because they fear of being discriminated, so they don't seek help. Yeah, and then they avoid working. Yeah, and they also fail to pursue work because of that discrimination, and they have limited opportunities. All right, limited opportunities. So like I said, if you compare, if you go to apply for a job, and if you were the employer, of course you would want to take someone, you know, without any, even without any physical help. right? Okay. So, and of course, when that happens, when they do not seek help, it will actually worsen their mental illness condition because they don't get a proper treatment for that. Right? So that is the danger of this stigma and also discrimination. Okay, with that, okay, so before we, before we want to go further into mental health issues, so I think the basic of talking about mental health issues is to understand stress, right? I think it is very, very important for us, all of us, to understand what is stress and how the stress contribute to the development of mental health issues. Okay, so as you know, okay, stress is actually normal physical, emotional, and mental state of arousal, right? So in it is in response to events that are challenging on or perceived as threats. Yeah? For example, for students, yeah, exam is actually a threat, right? A threat that you're not sure whether you can pass or you can fail. All right. So that is events that is challenging to you. So once I think most of us have gone through exams, so we know, right? During exam, what will happen to us? Stress. So we feel stressed. And based on the physiology, I think later on Dr. Rafidah and Dr. Izzah will explain the physiology of stress. As simple the physiology of stress, yeah, when you are in stress, you will have this fight and flight reaction. So where your breathing rate will increase, where your heart rate is increased, yeah? And your heart also becomes you feel your heart beats faster, yeah? And you're always on in what do you call that?
High alert.
Yes, on very state of alert, high alert, yeah, or high alertness. So like sort of ready to run, yeah. When you see a dog, yeah, trying to, so that's also a threat, okay. So it's like that, So anxiety, stress is like that, all right. So you in a way we need that stress. Yeah, we need that stress because if we do not have stress, we will not do anything. All right. So exam, man. If we don't, exam is just a week away, or we just, like relax, no stress. So what will we do? We enjoy watching TV, watching Netflix, and all that, right? So we're not gonna perform. We're not gonna be motivated to perform, right? So this is really true, based on this Yerkes-Dodson curve, yeah, showing that if there's low stress, so you'll be sleeping, you'll be enjoying your life, all right. But you have medium stress, then that is when your performance, you become more alert and your performance is optimal. But if your stress is too high, overwhelmed, so that is when your performance drop. So this is what happened to those having overwhelmed stress. Okay, right? So when you notice that their performance is deteriorating. Okay, so just to let you know what are the symptoms of stress. So most of the time when we talk about stress, we always talk about anxiety, feeling having fear and feeling anxious, right? But we do have physical symptoms of stress. Headache. How common of you? How common is headache to all of you? So there is a term called tension headache. Yeah, tension headache. All right. So remember, notice or not, when we have stress, yeah, a lot of stress, yeah, a lot of work, yeah, and you start develop to have you start having this, yes, yes, muscle ache, yeah, and then headache, yeah. So these are all physical symptoms. Feeling fatigue, feeling very tired, yeah. Okay, and then okay, one of the common symptoms, early symptoms that you can notice, yeah, when you have you're stressful is actually when you have difficulty to sleep, your sleep problems. Okay, having sleep problems. Okay, one is either you have difficulty to initiate sleep or fall asleep. Yeah, so meaning that you will be awake throughout the night. So that is one of the types of sleeping problems. Or you can actually fall asleep, but you wake up a lot in the middle of the night. So meaning that your sleep is interrupted, and then you have difficulty to fall asleep again. Right? And then you just waking up until uh, until subuh, for example. Okay, alright. Or you can fall asleep, you sleep through the night, but you wake up earlier than your usual waking up time. So for example, as you usually wake up at 6, but you notice that nowadays you wake up earlier at 4 o'clock, something like that. Yeah? So that is the type of sleeping problems that you can have if it's related to stress. Okay, all right. Okay, other than that, behavior symptoms, okay, you can have behavioral symptoms as well, okay. So where you start excessive eating, for example, or sometimes poor appetite, yeah. Or sometimes, most of the time is poor overeating lah, yeah, right? Overeating, sometimes oversleeping also, yeah. Or very impulsive, very irritable, okay. Losing appetite, but most of the time if it's just over stress, yeah. Okay, and for those who smokes, yeah, they do excessive, they increase in their smoking, this one, yeah, because that they perceive that smoking gives some calmness effect. So but nowadays the young ones, what do they do? Vaping. Apart from vaping,
Recreational drugs.
recreation drug, this one, gadget. Gadget. They start to indulge in internet. So that is when you have internet addiction and all that. Yeah, right. And of course, thinking, you lose focus. And one of the common complaints that you would have is actually lupa lah, forgetful. Becomes forgetful. Kan banyak lupa. I mean, a lot of forgetfulness. Yeah. All right. And of course, reduce self-esteem. Yeah. In a worst case scenario, you become so helpless and feeling worthless. Yeah. And then feeling hopeless. Okay. All right. Okay. Impact of stress. So if it's too overwhelmed, if it's continuous until it affects your function, then you need to be worried about that. Yeah. So you notice that your work performance is not as before. Yeah. And there's increased risk of stress-related disorders, for example, depression, anxiety, and psychotic illness. And the key symptoms is actually there's impact function in social or occupation. So for students, for example, you notice the grade is deteriorating. Okay. And for those who work, so you notice there'll be more frequent medical leave. All right. And then there'll be, they start missing in action, right? And then social function, you tend to isolate yourself. Yeah, you do not want to meet people. Yeah, you do not want to, last time you used to like going out, going for window shopping, going to see friends, and now you're not doing that anymore. Right? So I think that's the key symptoms that because people say, okay, stress is stress. Okay, so how do you know that it becomes abnormal? Is when your function is affected. Okay, right? So what are the contributing factors? Okay, when you talk about stress related disorders, mental health issues, it is not just, it's multifactorial. All right, it is not just genetic. Okay, genetic meaning that if you have a family history, so it's not 100% that you will get it, because majority of it is actually depends on the environment. Okay, sometimes it can be work related or stressful life events, for example, death of a person that we love, yeah, and then death of a spouse, for example. Yeah? So all the life event that can actually sort of contribute to that risk of mental health issues. Yeah. Okay, depression. All right. So just what are common mental health issues? So depression. Depression usually starts with sadness. All right. Sadness is a normal feeling. Everyone should feel sad. Okay, it is not normal if you don't feel sad. All right. Okay, but our sadness is very depends on a situation. So if let's say we face with some sad life events, yeah, so of course we feel sad, but later on you will the sadness feeling will resolve. But depression, okay, is a continuous and persistent sadness feeling. All right, and in which it is associated with other symptoms. So you have loss of interest, you don't feel like the world is sort of a happy place to live. Yeah, and you have poor sleep at night, so you start having losing your appetite and having significant weight loss, and this is feeling hopeless, worthless, and helpless. Yeah, so feeling hopeless meaning that you cannot see your future anymore. All right, so most of the time what we how do we ask our patient, yeah, about feeling hopeless, how do you see yourself in future? And majority of them say, I don't see myself in future. All right, so when you have this feeling hopelessness, okay, and if it's very severe, this is when they start having these suicide ideas. So because they don't see themselves in future, right, they don't see that they will sort of live in the future, so that is when they start having these suicidal ideas. Yeah, so of course increase suicidality and impact function. Okay, anxiety disorders, there are a few types of anxiety disorders. Yeah, so one is generalized anxiety, meaning that you feel anxious, you feel worries most of the time. All right, and it is excessive. We can have this feeling worries. We can have, we worry about after this, where do we want to go? Yeah, we worry. After this, whether we can catch up the train and go back to the hotel. That we also worry. Okay. After this, overthink. Okay. But when it becomes persistent and become excessive, so you will think about every little matters in your life, and you notice that you have this struggle to stop that thinking. All right, so that is when it comes to many companies with this muscle aches and everything, and you also feel irritable. All right, feeling restless, and you lose focus. So that is, and it is persistent. If it's persistent more than 6 months, so when accompanied with function impairment as well, so that is when you need to seek help. Okay, all right. So panic disorder, I'm sure maybe some of you have experienced panic attack. Have you ever experienced panic attack? Experiencing panic attack is one of the experience that you, if possible, you wouldn't want to experience it. It's just like feeling that you want to die, feeling of impending death, and most of the time they feel that am I having heart attack? And most of the time, if it's too severe, they will straight go to emergency department. All right, because they thought that because their heart is racing very fast, palpitation, and at the same time you feel like tingling sensation, and then you feel that like all your as if you want to faint, right, and that is when you notice that, am I having a heart attack? So most of the time they go to emergency department, right, and get some help, and or the ECG was done, everything, so everything is normal, and it's recurrent. They keep going to the to the emergency department to get help. And finally, the doctor said, no, you're not having heart attack. I think you have problems with panic disorder. So if it's recurrent, okay, up to the point that they avoid going to into public transport, they avoid going to uh, uh, shopping complex. So because they're afraid that if they have this panic attack, recurrent panic attack, they will actually faint and nobody is going to help them. So that is when they become, in the worst case scenario, they become housebound. They don't go out unless it is accompanied by someone. Okay, right? So they definitely avoid going to for us in UPM, IOI lah, they wouldn't go. Okay, social anxiety. Okay, this is common among students. Yeah, we notice intense and persistent fear of being watched or judged by others. So if you have students, yeah, who most of the time avoid presenting doing good group presentation, and they avoid presenting, they rather do the background work, they do not want to present, then you maybe you want to ask lah, is there any problem with this social anxiety disorder? So they avoid such situations. We notice this among our medical students, because medical students have to do a lot of case presentation, in front of classes, in front of the specialists, consultants, and they have this very intense and persistent fear. So the reason why they have this fear that people will actually look at them and then judge them. This is just their perception in relation to the anxiety issues. Okay, in regards to religion, spirit, and spirituality, okay, spiritual with mental health issues. So I think people use religion, all right, and spirituality in relation to mental health in a way that one that there's an advantage. There's an advantage here. Why? Because when you look at religion, we always have sense of purpose. All right. So sense of purpose that in relation to life, death, and struggles. So sometimes, most of the time, people use religion as a coping mechanism, in dealing with stress. Why? Because for example, we feel that whatever struggles that we have is actually comes from Allah, and there must be some hikmah behind that, and that actually gives us resilience in when we face adversity. All right. And also when you have you refer back to religion, you use religion as a coping, there's always a sense of social and emotional support that you have from the group, the communities. And I think the third one is of course, like I said, majority of us, okay, I mean in Islam, majority, if you notice that especially the older age group so they use religion as a form of coping, so which is actually good in managing their stress and also managing their mental health issues. But I think with the current generation, is quite difficult to penetrate that thinking. Why? It's like this. In our therapy, usually, when you talk to the younger generation, because parents, we were brought up in those generations, where I think in terms of our practicing, in our religion, I think last time we said, for example, we do a lot of salat, we do a lot of zikir that would actually help us in coping with our emotion, stress, and all that. Okay, but nowadays when you talk to the younger generation, it is quite and sort of irritating for them. When we told them, for example, parents always say, if you're stressed, bangun, wake up in the middle of the night and do a lot of zikir and do a lot of tahajjud. Right? Or they're very angry with that. They're very annoyed. Yeah, because what the perception is that, what are you saying? Are you saying that I'm not doing enough? All right. So so that's why in term of communication, when you communicate with this younger generation, to ensure that uh, you communicate in a very non-judgmental way. Because if you're saying that, okay, do a lot of salat, do a lot of ni when you stress and all that, so it's sort of judging them that they are not doing that enough. So in therapy session, so it's very important. The communication should be non-judgmental. For example, I think the question just now during Dr. Izura's session, how when you want to uh, use social media to talk about good things, and then people will say something. So if you can communicate in a very non-judgmental way, all right, so I think that will be much helpful, rather than give like positive toxicity lah. For example, doing good and everything. If you don't do good, if there's something wrong with you, there must be something that you have done in the past or something like that. So that is very judgmental. So, and this those people with mental health issue, they really, I would say they are allergic to that kind of statement, a judgmental statement, right? Okay, so okay, for example, religion also. For example, doing a lot of prayers, meditation. I mean, some religion they use meditation, doa, that zikir, listen to zikir. These are a way. This is in a way give you some form of relaxation, which is the basic of how you want to start managing your stress. So if they can do it, so why not? We encourage that, and it helps them in terms of uh, give some relaxation, because just now we talk about fight and flight reaction physiology. So when you do some relaxation, of course you will reduce your breathing rate, so that eventually would help you to manage your anxiety, right? Okay, I think whatever that I say, okay, so please seek professional help if the situation is out of control, despite whatever measures that we do, because the key, the most simple treatment that we usually advise a patient, how do you control your anxiety, is actually the breathing relaxation. Okay, breathing relaxation, also progressive muscle relaxation, because you will notice that when you are tense, when you are stressed, your muscles is always aching, no? So in a very tense position. So sometimes you forget how do you feel when you are in a state in a relaxed position as compared to stressed position. Yes, that's a situation where your muscles is majority of your muscles are tense. So that's the basic of our therapy usually. The simplest things that you can actually advise friends. So the professional help can come from counselors, psychologists, or psychiatrists, or any mental health experts. So I think with that, thank you very much. Okay. Thank you. You need to drink.
Thank you, Professor Dr. Normala, for your wonderful sharing. So I have two questions. The first one, is there any reasons why mental health increase in young generation? Is it due to the greater awareness, or maybe due to their parents' childhood trauma? But they never realized about that. And my second question, what is your advice for those who are working in Japan with long working hours and with no weekend off? because I think Japanese people always think that their job is like patients. So I'm not sure how can I tell if I'm crossing the line to self torture or self neglect. How can we
Okay.
differentiate between patient or maybe it's just you just neglect yourself?
Okay, so the first question, yeah, the first question is lupa. Okay. Okay, increase rate among younger population. Okay. I think one of the things that we notice, there's reduced resiliency among younger population. Why? Because with the technology, everything is at their fingertips. Yeah. So sometimes have they do not have the skill, the skill to solve problems, for example. All right, to cope, for example. To solve problems in a way would actually increase your resilience. Okay, last time I think most of us lah, majority of us, because most of us ni about 40s, the Gen X and Y kan. For example, I usually give my students very simple examples. Last time when we want to go to the library, we have to find, one by one, which bus to take to the library, and find books and everything. So it's on our own. So in a way, we sort of think about it, try to solve our problems, and if sometimes it's trial and error, based on trial and error. All right. So nowadays it's not like that. Nowadays is everything is at their fingertips, right? And then I think we should also sort of blame the parents nowadays. Yeah, it's our generation lah, us lah, Yeah, we do not want to see them in a very difficult or challenging position, so we sort of give everything that would make them easy for them to, so meaning that they get things very easy nowadays. So I think that would actually affects their resilience in things. So that's why I noticed that uh, you know uh, even at the very young age, can in secondary schools, you notice that they have this difficulty to deal with adversity in life, right? And also of course with the AI also, with the social media, everything, they get information about, now they like to self-diagnose, don't you, do you know? Self-diagnose. And now we always have this, young generation coming to our clinic, telling us that they have this ADHD, they have this depression, they self-diagnose because of, the availability of tools, information. Doctor, do you think that I have ADHD, so that's why I think they're more open. And they seek help lah. That's, I think, one of the reasons. Your second question is about working hours. Japan, they work on weekend.
For me, I just working for 1.5 months and I have no weekend off.
No,
One month.
even this one.
I came here before that. I go to the lab first. Then after this, I have to go lab.
Oh, okay. So meaning
So
here,
maybe I just adapting myself.
you're in a period of adjustment. So
But almost of them are like this.
So I think that's why the term tu, karoshi. So meaning even the schools is on Sundays.
That one I'm not sure.
Yeah.
School
Okay. So but working people works on Saturday, Sunday.
I think because of the project is based on cell culture, so we need to feed the cells and do the lab work.
I see.
It's very
Okay.
intensive.
All right. And your question just now, how do
How
you?
can we differentiate between whether this one is a patient, are we are really patients in that kind of jobs, or it just how can we tell that are we cross line to the
Okay.
cell?
Are you referring to burnout ke?
Maybe.
Ah,
I'm not sure. I'm not sure.
Alright.
Because
So
when-
like I said kan, stress is normal. Okay, you can feel the stress. But if it's too overwhelmed, then you notice that your performance will be dropping. So meaning that your concentration, you have start losing concentration, and then you start having loss of interest and everything like that. So if you it's normal stress. Once you can actually recover lah, meaning that it is much easier for you to go back to the normal state. Okay, but if it's continuously, and then there'll be a state where you is overwhelmed with stress, and then you become burnt out. So that is when you notice your performance will start to deteriorate. So I think the key important point here is actually for you to notice in terms of your performance and your interests, because that would actually determine whether that is uh, bordering normal or not
What
normal.
about if we don't realize? Some people,
Yes, don't realize too is another thing, because sometimes you thought that is,
everything normal, right?
yes, that is part of that,
Mm.
part of you actually. But you can actually maybe people around you will notice that. So maybe you can actually help counter check with people around you with notice, because sometimes it's very clear, because they can actually notice. Sometimes they will say kan, hey, you're not yourself anymore. You can always, meaning that you need someone, to be around. I mean, you need someone to talk to, and you need someone to share your experience, and also stress, meaning that you express your concern and everything. Yeah, you always get someone to be there to listen to you. All right. So make sure that if you have this burnout, can you may need to take a break actually, because if it's continuous, then that is when later on you become depressed, or you become anxious and all that, having anxiety. Okay. All right. Oh.
We need to improve our GABA reaction. So my question is, how do we improve the GABA? So that we don't have the anxiety.
Okay. All right. Sometimes with anxiety and depression, because mental health issues, it will affect your emotion, your thinking, and your behavior. So your thinking and your emotion too will sometimes reflected in your behavior, right? So when you are very anxious, sometimes when kita for example, because we do combination now, we do combination therapy with medication and also therapy. All right. So sometimes if the anxiety symptoms is too overwhelmed, okay, whatever that you do for that therapy, it doesn't because in that therapy sometimes you need to listen, you need to do some homework, so you really cannot engage with that. So most of the time what we do is we give treatment. So GABA, so most of the time is actually and
Do it naturally without medication.
you can, but it will take time. It will take time. So sometimes it's too overwhelmed for the patient, because he said, cannot, doctor, I cannot, I cannot stand the anxiety. Yeah, so that's why we want to make it faster. We use medication. Medication that would actually help in that GABA. This one. So most of the time is the anxiety.
Is there natural product that can improve the GABA?
Natural product. There's no so far we don't. Of course lah, all the substance too it helps, but later on become addicted kan. So natural product, there's I think as far as I know, none. But that's why most of the time patient will come. They say, oh, this product is maybe helpful. I say, okay, that's okay. You try for 3 months lah. You try for 3 months and see whether if it's it helps you, then you can continue. No scientific. At the moment, no scientific evidence for that.
Boleh tanya lagi?
Huh?
Thank you so much for Normala for the insightful presentation. Thank you. Congratulations. I would like to ask about the harmony just now. Yeah. Because we in Malaysia, we live in such harmony. Even though there's a friction here and there. Do you think it's better to take care of the harmony, or we need to speak up and face the reality of
Okay, all right. So when you talk about harmony, for example, in Japan culture, Japan culture is always about make sure every everyone is okay, and sometimes at the expense of your own issues, correct? Okay, so yes, if you look at the concept of mental health, of course, you want everything is in harmony, all right? But in reality, all right, okay, most of the time patient with personality that always want to sort of please others. Okay, please others, kan? We always think about others, of course it's good in a way, but sometimes we need to take care of our own self first. So how do you do that? Is actually by one of the things that you can do is being assertive. Being assertive, being assertive meaning that you always tell, for example, I give a very simplest example. Okay, in our workplace, okay, it's always because we can do our work. It's always we are the one who be burdened with more work because our boss looks at us as if we bagi je kerja, we give you the work, it can be settled, so most of the time the burden will be on us and not the others. All right, so but majority of us has difficulty to say no. Correct? Majority of us, right? So that's why in one of our therapy session is actually to learn how to be assertive. Okay, to learn how to be assertive in a non-aggressive way. Not like I do not want to do that. So no, you can always tell in a very assertive manner, saying, okay, boss, all right, so I know that you really trust me, okay, but I think for this work I don't think that I can do, all right, because the previous work also I am still try to complete it, okay, so I think for this time, if you don't mind, I would actually pass. Probably you can pass on to another colleague, but in a very assertive way. All right, not in a very unsure way. That you can always be sort of pujuk by your boss. You do it lah, you do it lah. Okay, so in a very assertive way, because in how do you communicate things in a very assertive way is eye contact, your body, your body language must be so I think that is that majority I would say those who come to seek help have very difficulty to communicate in a very assertive way, especially husband and wife relationship. So
Ingat
that
lagi senang.
huh?
Ingat lagi senang.
So that is when the communication is is having problems. So yes, harmony, okay. So that is when we are not assertive, so we tend to sort of try to not hurt others, basically. When we are not assertive, we do not want, kan, when our boss say, okay, it's okay lah, we just do. We do not want to create friction with the boss or something like that. But actually, it's okay to do that, and it's actually encouraged to do that, to say no, boss. But of course, in a very the communication must be correct lah. It's not in aggressive manners or something like that. Okay. I answer the question. Okay.
May I know what's going on actually in Putrajaya, because I heard previous years, a lot of kids have a bunted problems.
Oh, okay.
In Putrajaya. And now you showing to us a lot of kids there. Mental health. What actually in Putrajaya?
I think it's very political. Okay, I think I think more surveys need to be done to look at, because we know Putrajaya is a working population, and if you look at the social demographic, it's majority middle income, middle income working population. So I'm not sure with regards to the undernourished part lah, because masalah bantut dan sebagainya kan. Stunting, they call it what? Stunting. I think, in fact, one of our researchers, Dr. Prof Asma from nutrition, is actually collaborating with Ministry of Health to look at these issues of stunting ni. At the same time, if you look at the demographic, those coming from low socio-academic background actually has a higher prevalence of mental health issues. So I think we need to look at other aspect, other factors that actually interrelated with this lah. So maybe in terms of upbringing, parents, they are all working population, so they probably have stresses as well. And then in terms of their upbringing, how are they brought up in that area lah. So more, I think, more studies should be done. That's why. It's about working.
Ada soalan daripada
Tadi dia ada question.
Ah.
One of our TikTokers viewer.
Oh, okay.
The question is there anything for being distracted? Like when you have to focus, you feel uncomfortable. Distracted.
Huh?
Like, is there anything for being distracted?
Distracted kot. Distracted. Distracted.
Like when you have to focus, you feel uncomfortable.
Okay, I need to understand the question. Can you read that again? Maybe I can make it online. Is there anything for being distracted? Like when you have to focus, you feel uncomfortable. Okay, meaning that when you try to focus on something, then you feel uncomfortable. And how do you deal with that or something? Is there anything for being distracted? Like when
easily distracted.
So like when you have to focus, you feel uncomfortable. I'm not sure that uncomfortable meaning what? When you try to focus and feel uncomfortable, or you want to focus and you are easily being distracted, and how do you deal with that? Hmm?
Very hard to focus on.
Very hard to focus.
Maybe very hard to focus.
Okay, very hard to focus. All right. Okay, and very hard to focus. Is there anything for being distracted?
And
I-
to prevent from being distracted.
Oh, is it for
Or
to prevent from being distracted?
tips for to focus, good tips to focus.
Okay, tips to focus. All right. Okay. All right. Okay. Sometimes when we are trying to focus, okay, we try to focus. We try to look at things as a whole. Yeah. So sometimes, yeah. For example, okay, I want to focus on, on reading one topic, for example. All right. So when so in a way you need to strategize lah. Strategize meaning that you have to break up the topics into small topics so that you may focus on you may focus it in in sort of clusters or groups, small things, rather than try to look at the things that you want to focus in a big chunk like that. So I think that would be helpful. Yeah. So for example, a topic that you want to focus. Okay, you want to read something. Let's say mental health. Mental health is a big topic, right? So look at the content. All right. So for example, mental health definition. So you focus on that first. In a bit in a group. Make it, categorize it, so that you be more sort of focused in a small content first, rather than try to sort of read the whole topic of it. All right. So when you deal with focus, yeah, it's always good to break it up into small, or categorize it into small areas that you want to focus. Same like you want to do something. Yeah. So I think this is what we do in those people with attention deficit. Yeah. And also because they have this very short attention span. So that's why you need to break up into small tasks. Yeah. All right. Okay. All right. Okay.
Meditation is difficult for me, so can I do it to try yoga?
Meditation.
Yes,
Ah.
difficult for me
Ah.
because my mind is not playing.
Oh, okay. All right.
So can I do yoga exercise?
That's why I said usually what the concept is for you to have breathing relaxation, is for you to reduce your heart rate, and then to control your anxious feeling. All right. And later on, and do with together with the progressive muscle relaxation, is to reduce with your muscle ache, tense of the muscle aches and all that. Yeah. So yoga in a way, it sort of would help with the muscle relaxation as well. Then that shouldn't be a problem. Okay. All right. Okay. Thank you.